Okay. Good afternoon, everyone. Welcome. This is about the individual education plans for children ages 3 to 14. And we have I'm sorry. Okay, my first mistake. All ages, actually. And we have two speakers today. We have Wendy Miller, who has graduated from Stephen F. Austin and holds a special education teaching certificate. She has over 13 years' experience working with special needs children with an emphasis teaching communication. She worked as South Lake Carroll's Assistant Behavior Specialist and as a Certified Crisis Prevention Institute Nonviolent Crisis Intervention Instructor, providing training to district personnel. In 2015, Wendy partnered with Desiree to provide an array of services to families with special needs members. And our first speaker today is Desiree Kesting Nowak, and she graduated from Baylor University with a degree in special education. She is a board-certified assistant behavior analyst and has over 15 years' experience working with children and adults with special needs. She served as South Lake Carroll's behavior specialist and teacher trainer for 11 years, while also working as a consultant for Central Texas Autism Center. In 2015, Desiree founded Nowak Consulting, LLC, partnering with Wendy Miller to provide an array of services to families with special needs members. Please welcome Desiree.
Welcome, everyone, and we're so glad to be here. We're very fortunate that my business partner, Wendy, has worked with a parent that is really big in your foundation, and she's carried on that both professional pieces working with her child, but also as a friendship developed as well, as the daughter now is in high school. So we appreciate that we were invited to come speak today. As we are being recorded and live streamed, we do ask that you will silence your phones. Now, today when we're talking about, I just want to clarify, participating in your child's IEP meeting, that if you currently live in the state of Texas, this is this is the same as an ARD committee meeting. My experience is in Texas only, and so we call it an ARD, but I'm familiar that we are the only state that calls it an ARD, so we will call it the IEP meeting today. All right, so we're going to start out and talk about an individual education meeting. So they must occur at least a minimum annually. You can really have as many ARDs as you want. You also have the right to ask for an ARD, but at minimum, best practice says one IEP, sorry, not ARD, IEP a year. In this IEP meeting, you would be discussing any concerns that you have in your child's program. The staff should also come and report on the current goals and objectives. They should use data collection and share that data collection that gives the progress, not share the data, but read the data and reflect in the data that shows what the progress is on each goal and objective. And the goal is that your child or young adult is making progress on that goal. Because if not, then that may need to be something revised and looked at differently. Staff also should be reporting on assessment. Now, there are 3-year evaluations that occur every 3 years. But when a student has an IEP, minimally a year, an assessment should drive the goals and objectives. In the last session, I just spoke and shared that in my experience, I saw a lot of staff making goals just because Sally had those goals, or Johnny had that goal, or in the classroom, that's just what they worked on, or maybe that somebody else told them that, I think this would be a good goal. Well, it's okay to communicate and share with each other, but again, it should be based on assessment. Staff should share their new draft goals in this IEP meeting. So they come with their assessment, share the results of the assessment, that can be a brief summary, and then move on to share what those new goals are, as in draft. Discuss placement and services that should be provided. And so we're going to get and discuss this, but, certain placements, that's what classroom, what setting, are they more in general ed, are they more in special ed, are they doing a 50-50 combination of the two, and also services provided as far as the special services. So are they getting occupational therapy, are they getting speech therapy, are they getting physical therapy? You can request an IEP meeting at any time during the school year. I'll be honest, because now being in the private field, I'm not bound by the school. It's typical that schools don't want to do this, but legally you have the right to meet as often as you want, okay? So, and this is just my experience. You may be in a district that they love having IEPs, but I personally have not been in one. Participants, parent, the primary caregiver who has guardianship, or you're the parent, you are the primary member. You are a legal member, whether you're there in person or you're doing it via phone, FaceTime. The administrator should be there as well on the campus. A general education teacher is there to represent the general ed. Remember that all children and young adults are general ed kids, students first. Okay, I think that gets forgotten a lot of times, is that every person is a general ed student first. This general ed teacher may provide information if your child or young adult is participating in their class, but they should be there and speak on behalf of general ed. Specialized service providers, talked a little bit about that. It could be a music therapist, it could be a speech therapist, occupational therapist, it could be a behavior specialist. Me serving as a behavior specialist, I attended any student that had a behavior plan or that I was working with, I attended their IEP meeting, and I was a part of that, and I also developed goals and objectives as well for that child and a young adult. A transition specialist is not in every district. If you have one, that's great, and as of the age of 14, they should be involved in your child's IEP. If you're kind of like, what is a transition specialist? Well, you want to go back and find out, do you have one, and if not, who is in charge? I shared earlier, we were speaking on transition, that I have a friend that I grew up with, and she is in a very small district. She is the school psychologist, but she is also their transition specialist, so that is her job as well. Your child can be a part of the IEP. That typically happens around the age of 14. They should be invited to participate because they can advocate for themselves. Some cannot advocate for themselves, but they can sit there to listen as we discuss, if appropriate. If you sometimes parents would like to have their child there just so they can start getting comfortable. And what it may look like is they're just going to stay maybe for the introduction, and then they'll go back to their classroom. Or maybe they'll stay 10 minutes and then leave, and start just building up as they get older, their participation. Appropriate adult behavior in an IEP meeting. It's important that we talk about this because sadly enough, we have seen IEP meetings gone bad. And so to be proactive, we're just going to go ahead and go there and talk about it. So all adults are expected to speak respectively and treat others with respect. That includes you, that includes that therapist that's in there, that includes that administrator that's in there. Anyone in that room should be respectful. Adults should not interrupt another speaker. They should wait until the speaker is finished prior to then projecting what they want to state. No party should use foul language at any time. If it does occur, the meeting should be adjourned until the speaker can regain control. And if the speaker cannot regain control, then it would be wise just to recess, take a break, or to not end the IEP meeting, but to schedule to come back and complete it on a different day. Phones should be silenced just for respect, but the use of a recording device, it can be used, but it has to be disclosed at the beginning of the meeting. So, for example, if you want to record, you have the legal right to record. You just need to let them know, hey, I'm going to be recording today. I'm going to, have my phone out, or I'm, even if you want to share, I'm taking notes, so they know if you're bringing in an iPad or a laptop, that's how you're participating. And some school districts, and most probably, will say that because you're recording, then they are also going to record too, so you're both on equal grounds. Okay, so now we're going to talk about assessment, because assessment drives the IEP, okay? So what is the purpose? Not only to identify the strengths, but to identify the deficits. And they're going to lay the foundation of your child's IEP. Who is involved? Who is a contributor to the assessment? It's a team approach, and it should be a team approach. It should not be just one party. They should be working collaboratively together as a team. So when I say that, we have all these different members. Now, their assessments may be different, but they should be collaborating and talking about what they're assessing and to share those results. So let's start with the general ed teacher. They're going to report the classroom participation. They may even share testing that they've done based on their criterion referenced assessments or their curriculum-based assessments. The special ed teacher, update progress report and conduct informal assessment to guide the development of goals and objectives. So there, where I was saying earlier, is that goals are not just because this is what we do in my classroom because it's preschool and everybody needs to know about community helpers, right? Not necessarily appropriate. So they are to use an assessment and share those results. The parent, you're involved. You should be able to share, what your goals are, and what strengths and weaknesses that you see with your child. What is important in your opinion, what is important, for your child, and what skills that need to be developed or continued to be worked on. Sometimes the district may ask you to complete like a written survey or assessment or do something informal. They may just want to have a phone conference, but you are a part of the team. Therapist, they should be completing either formal or informal assessments, and I want to emphasize right here, in their specialized field of study, okay? Because we have to remember that as unique in our fields, that we need to focus on the areas we have been designed to teach and to work in those areas on. So when I say that, I don't want to see an occupational therapist coming in and telling you what your speech goals are, or a speech therapist coming in and telling you what your physical therapy goals are. And everybody, just in my world, can tell you what the behavior should be. So everybody needs to be respectful, but you need to collaborate, because the reality is, as a behavior specialist, I may still be implementing and working on goals when I'm in the classroom with that student. Or Wendy, when she was a classroom teacher, she's going to be implementing and embedding those goals that they have designed on their assessment, because she as the teacher would be spending more time with that student. So she would be, embedding that. The behavior specialist could be conducting what is called a functional behavioral assessment. If behaviors impede with the learning for themselves, the learning of others, then really we need to assess what's going on. And so sometimes parents have to request the functional behavior assessment. Sometimes the teacher will request it. Now, there must be consent to have the functional assessment done and completed. But that is the tool to use to develop a plan to both increase positive goals and to increase positive outcomes and decrease the areas that we want to reduce. Outside of school services, they can complete formal or informal assessments. In my experience, we've had other students who go to private speech therapy or private physical therapy, or maybe they're going to an ABA clinic outside of school for applied behavioral analysis. So they can also provide information in that IEP and share that as well. The transition specialist, I touched briefly on that, but definitely around 16, maybe even if appropriate 14, that transition specialist can be conducting assessments as well and gathering information about what the child's future looks like post-high school. So we're going to do the Q&A at the end. Where you have a question, we'll do them at the end. So the functional behavioral assessment, if data shows, as I said, if their learning is interfering with his or her learning or the learning of others, it may be important to conduct this assessment. And the parent should give consent, and the purpose is to identify why. You know, well, first of all, what are the problematic behaviors? But the whole reason to have the assessment is to find out the why. Why are they doing it? Because behavior functions for a reason. And so it's important that the assessment finds out why the behavior is occurring, so then interventions and goals and objectives can be treated based on that information. And the goal is definitely to decrease those behaviors and increase appropriate behaviors. I shared earlier in the session before is that we hear the word behavior, but keep in mind behavior is not always problem behavior, and it's not always maladaptive behavior. So when we're looking at problem behavior, we want to increase appropriate adaptive behaviors, okay, to replace those problematic behaviors. As a result, goals are developed to increase appropriate behaviors and decrease problem behaviors. So when looking at this IEP process, we're going to talk about the time frame of this, and I will hand it to Wendy. I knew I'm like, which slide? But yes, we'll do Q&A later.
Thank you. As you can imagine, it does take a significant period of time to conduct a thorough assessment and get ready for the IEP meeting. So we would always encourage the staff in our district to allow 6 weeks. That is because, you know, there are field trips, there are holidays, people get sick, there are conflicts, assemblies, things come up. So 6 weeks allows time to conduct the assessment. The teacher, after that, will write a summary. In Texas, we refer to that as a PLAF. That's the present level of academic functioning. That is a summary that they will present in the IEP meeting. Based on that assessment, and only after that assessment and summary, should the teacher draft measurable goals and objectives. Once that is done, all staff members are encouraged to meet with the parent or caregiver prior to the IARD, the IEP meeting. That way, the IEP meeting can run smoothly and quickly. It also gives you a lot of respect as a parent. The teacher is presenting, this is what I have found, this is what I suggest. Please read it over, let me know if you have any questions. It's a very collaborative approach, and that way it can answer your questions before you're in a group setting. Sometimes these meetings can have 10, 12 people sitting around a table. So we encourage a lot of time to do that process. I'd also like to note here that as a parent, you know that these meetings have to occur once a year. The district will typically schedule it anywhere, it might be a month ahead of that last year's date. So think through, was your meeting February 1st this past year? You might just think backwards, wow, January 1st we'll be on holidays. I wouldn't be surprised if the diagnostician notifies you that that IARD meeting, the IEP meeting, is now scheduled December 10th. So you might have these meetings more frequently than you expect. If you're getting close to that annual date and you've not heard from the district, please contact your teacher, and they will find the diagnostician that works with your child and let you know of the scheduling. You're required to be notified, I believe, at least 2 weeks, if not a month ahead of 10 school days ahead of the meeting. That's right. Could be different parts of the country. But just be aware of that date and start looking for that probably at least 2 months before your last one. Now let's talk a little bit specifically about the goals and objectives. Desiree did a great job explaining who those team members are, and quite often there is a large staff working with our special clients. They might have behavior goals, occupational therapy goals. They might have speech and language goals. It is very easy if everybody targeted every possible objective, a student could walk out of an IEP meeting with 40 goals. That is not realistic, nor is it in best planning. So what we would encourage is collaborating and presenting a total somewhere between 10, but definitely no more than 20 goals, because it becomes unrealistic in not only the teaching, but tracking the data and reporting on more goals. So the goals need to be collaborated, but limited. Each goal will include these 5 components. The goal will identify the learner. They will state the time frame for the goal. It defines the target behavior, which that behavior must be observable and measurable. It will identify the condition under which the behavior must occur, and then it will also identify the mastery criteria. So that often becomes a long run-on sentence, but it might sound something like, within 36 weeks, Susie Q will activate the communication device when presented and given a prompt 4 out of 5 times. So you heard that I mentioned the time frame, 36 weeks. The person, Susie, she's going to activate the communication device. The condition was when presented and given a prompt. And then the mastery criteria was 4 out of 5 times. So that is a clear, legal, measurable goal. The idea and the reason all these are important is that anybody should be able to pick up your child's IEP and replicate that goal. It has to be that clear. So goal writing is not easy. The primary special education teacher is responsible for the majority of the goal development. Since they work most of this day with your child, that they will not only have the academic goals, but they may, again, embed the speech language pathologists might have goals on requesting. So the special education teacher would take time during the day to work on those. As we had mentioned, those specialized service providers they are responsible for developing goals in their area, but then it's, again, collaborated with the special education teacher. So, as I had mentioned earlier, an effective IEP will have about 10 instructional goals. We don't want to reduce the program's effectiveness by being unable to teach everything. Our goals must be reported. Data must be collected on every IEP goal on a regular basis. We would encourage teachers to collect data 2 to 3 times a week. They should have a structured plan for when they collect their data. We also encouraged, if they were to have a behavior goal or communication goals, that data really should be taken every day. Teachers can do that. Data is their friend. It not only shows if their teaching is effective, it shows is the student learning, and then there's the documentation for the reporting. So data is essential, and it will be reported just as often as your general education students. So if your district, it might be on a 6 weeks reporting program, it might be on 9 weeks. If there's some of those longer time frames, you might get a mid-grading report. So that's why there's such a large window. It could be anywhere every 3 to 8 weeks. So Those progress reports come directly from the data that the teacher's been collecting during those 9 weeks. They need to be looking at the frequency, duration, setting, whatever was spelled out in those IEP goals. As I mentioned, the progress on behavior goals must also be reported because you are teaching replacement goals, so that is just as essential as some of their other programming. Now, if the child is not making adequate progress, an IEP meeting should be scheduled to address any changes that might need to occur. That IEP meeting could be suggested as from the teacher. The teacher might see, hey, we are halfway in through this child's education this year and we've only made 10% progress. I might need to change either the goal, the way it's presented, we might change the criteria. There's a lot of things that can be considered. But again, as a parent, be aware, and you too can speak up. If you're concerned that there's a lack of progress, you might suggest a meeting to kind of see what things can we change to make my child more successful. Desiree touched on some of these, and I just want to emphasize that you have the right to request a meeting any time of the school year. We know that the end of the school year gets very busy, so that can be a little difficult, but I also want you to know that just because school might end officially on May 31st, there can be meetings scheduled June 3rd. The window does not close just because the student is no longer in school. The administrators and staff are still there. You can attend in person or participate over the phone. We understand in today's world that not everybody can be at every meeting. If you're able to participate over the phone, they will put you on the speakerphone, and that is fine. You may bring your spouse or another family member. In fact, that can be very helpful, just like going to a doctor's appointment, another set of eyes and ears listening to help clarify, maybe to help remind you of some questions you might have. You can also record the meeting. And as Desiree said, just tell them up front that that's what you intend to do. And that doesn't mean it's confrontational. It's just, again, a great way for you to have a record of what was said and kind of frees you up from taking notes. You can bring those notes or take them during the meeting. And of course, you can bring an advocate or an attorney. That is something you definitely need to tell the district ahead of time. They would want to match that. If you bring a recording device, they will use their own. If you're bringing an attorney, they will probably represent with the district's attorney. So again, an advocate and attorney can make significant changes and speak for you. You just might not want to go there on your first meeting with the district. Give them the benefit of the doubt, and again, communication is the key. Quite often, things can be handled before the need to go to an advocate or attorney. So keep those lines of communication open, and always start with your child's teacher first. These meetings can be long. There's a lot of people involved, a lot of people sharing the assessments, the results. So if you feel like you're running out of time, or if there's too much information, you can ask for a recess. It doesn't have to be concluded in one setting. They'll typically ask at the end of the meeting for everybody to sign, and then they choose and note on the paper if they agree or disagree with the findings. And you are free to agree or disagree with any portion. Everything might look fine to you, but yet you have a concern of what the speech pathologist presented, so you could agree with everything except for one area. And then you can meet in person or come back to the ARD and then sign off on the ARD, the IEP in its entirety. And now in Texas, they give you the 5-day option to wait and sign the documents, whether you're in agreement or not. So it is no problem to ask and to use those 5 days. Frankly, there's not every parent is able to attend the meeting with their spouse. So if you're there by yourself and you'd like to take home the documents and review things, maybe ask some questions, that is your right, and you can certainly take advantage of it. I would encourage you, before you sign, Just make sure you are comfortable with that. No problem. So I know we kind of rushed through that to allow some time for questions and answers. Before we get there, I just want to point out this is our website, noacconsulting.com. We have more information there, and we have several different programs. We are located here in Grapevine. We lease space from a church that has been incredibly supportive year-round. We have our SOAR transition program. During the summer, we have Camp SOAR. We'll be wrapping up a few more weeks. We're also free to consult with families as needed, and we again present a lot of resources on our website. So please take a look at that. And now I'll turn it over to you. If you have any questions, we'll be happy to answer those the best we can.
I do have an announcement for everyone. At the end of this session, there'll be a 15-minute coffee break if you haven't had enough coffee already today. And there's an added GI issue question and answers at 5:30 in Bennett Boardroom. So if you had questions for the GI issue, Bennett Boardroom 5:30. Remember, and this is important, lean in a little, the rodeo dance party is tonight. 7 to 10. Silent auction will close at 10 p.m. tonight. Thank you, ladies. Questions?
Can I jump in really quick? There's one thing that we had done in our other session before that I think would be beneficial for us to just briefly discuss on is when in an IEP looking at schedule of services, if your child does get speech therapy, occupational therapy, or physical therapy, or any behavioral training, just keep in mind that some districts, what we have found in our experience is that as the child gets older, they're going to want to start pulling those services from your child's IEP. It may be appropriate. It may be appropriate that Wendy could work in the classroom on all of those goals and they don't need direct therapy or direct pull-out services. But there are other times that we see that it's based on because of their age. And so as being an advocate for our students is that just because they're nonverbal still in middle school doesn't necessarily mean that they should not be receiving speech therapy, or also in high school because, well, they still haven't, because we believe and we teach that communication and behavior take precedence over everything. And so communication should always be a target as far as being able for our kiddos to be able to advocate for themselves if they can one day, or just to simply be able to request their wants and needs. So that is one thing we have seen, that parents will put their foot down in an IEP meeting and say, I'm not comfortable with that. And Wendy earlier stated in our other session is that any recommendation like that from a specialist should be based on an assessment, or it should be based on data. So you could simply just say, you know, why are you making that recommendation? What led you to make that recommendation? They should have some form of data or assessment to drive that. Even if it's samples, even if it's videoing of what they can and can't do, but unless they have that, they shouldn't be making those changes. So just as a parent, I want you to know that we see that, and you know, it wasn't always based on the individual's best need. Okay, Q&A. And we're supposed to pass back and forth our mics.
Okay. Oh.
Yes. You can.
Would you repeat that question, because she didn't have a mic?
Here you go. Okay. What I asked was, can parents ask for copies of the assessments, or do they only get to see the summary that the teacher or whoever writes?
Yeah, you can ask for the assessment. We've even had parents come up and actually sit in the actual school, like maybe go into a resource room, library room, a quiet space, and look over even the manual or protocol that the teacher uses. You know, they don't send it home. It stays there, you know, on the campus, but parents can look and review that.
Okay, I'm a little unclear the difference in an evaluation and an assessment, because what happened, my child has been medically diagnosed as autistic as well as PMS, but when I brought that paperwork to the school last year about a month after our ARD, they told me that they would need to wait and do a school district evaluation because they had determined she was autistic as well as the medical or whatever, and then in the next year at the ARD they would evaluate that. But can I request that they go ahead and do the evaluation for the autism, or do I have to wait? They
No.
said to wait till the beginning of next school year.
No. You
Okay.
have the right to request it at any time.
Okay.
Yeah, that's a really good question. And there are a lot of our kiddos that have dual diagnoses. And so what you'll see is if you do have any type of private outside therapy specialist that you're going to, that school districts will want to review it, and a lot of times they won't accept it as their own. So yeah, they'll want to put their team together and do their own evaluation. But yeah, you have the right to ask for them to do it. And then they, dependent upon the state, there is a time frame that they have by school days to get that assessment completed.
Do you have any advice about medically fragile children and special accommodations in the IEP?
Absolutely. Wendy and I, we've had experience with medical fragile students. I think it's important that their assessment looks a lot different than other students because they're not able a lot of times to perform the criteria that some assessments begin at. There have been times in districts when teachers have to have been sent, myself included, to learn more about assessments to use for those that are medically fragile, looking at sensory, looking at your smells, your vision, your movement, and just different types of taste and just different ways that they can perform tasks and show eye movement. And so it should be very geared and specific. A lot of times with a medical fragile child or young adult, their day should be very therapeutic in our experience and in our opinion. They should have a more therapeutic day. And their goals, by saying that about that, is their therapeutic day should be represented in goals. And those goals should be specific in what that looks like, whether it's mobility, what is it exactly that you're working on, using adaptive equipment, and those types of things.
So if my child's already had an IEP and we didn't mark the box of medically fragile, do we need another IEP? Should I request that?
If there are no goals that are specific to that, I would definitely say, yes, we need to have an assessment and drive more goals that are appropriate for that need. Now, Wendy?
Yes, we both worked with a student who was medically fragile, and as he was coming into the elementary life skills setting and I was his teacher, I realized this was a new population for me. I went to my district personnel. I requested some additional training. I had researched online from the area region center for our school district. Here in Texas, we're part of Region Center 11. They have programs ongoing, especially during the summer, for teachers. Families can also attend that. So I was granted permission. I was able to learn more about that population and then integrate activities for that medically fragile child. So my thought for you specifically is, if they're going to be in that same classroom and setting for the foreseeable future, you might ask the teacher, are there trainings that the district might support you attending just for that training piece? And most teachers really have the heart and want to learn and would be willing to do that for you.
Hi. I'm wondering, so my daughter is just about to turn 3 next week, and we just did our IEP literally like a couple weeks ago. And we, by doctors, were told that our goal would be to put her in mainstream. And we weren't really given that option, so we did our observation right in a special ed class, and then when they wrote the IEP, they just wrote that that's what they were offering her. And I don't know, I've heard now from talking to other people, and I don't know if it's true, is that because she's in preschool and that's at a preschool level all that they'll offer, and otherwise it would be on us to get her preschool for like mainstream, or is it something that we could push back on and say, no, we'd like to have her observed in a general education or like mainstream class. I don't know if that makes sense.
No, it does. And it goes back to each child is general ed before they're special ed. And honestly, in the younger years, that is when they should be spending time with the general ed population. What we see is if when they get older and their program really changes to more functional skills, functional living, independent skills, that time becomes somewhat reduced. So yes, I would have a conversation about from day one being all special ed to not having opportunities with general ed, because that goes into, by law, what's called the least restrictive environment. And by law, we have to provide that least restrictive environment. Now, it could just be, you know, a part of a time period that they're spending with it. We brought up preschool in a district that I worked at. They actually combined with a preschool in Coppell, and then their students went to that preschool and they put a teacher at that preschool because they didn't have it at the time. So there are ways to make it work. So I think you're right in advocating that there needs to be that general ed piece.
Okay. So our son Matthew turned 3 in April, and he started it's an inclusion setting. Preschool, the public preschool program, and he just did ESY, and we're very happy with how everything's going. I think we're happy with what we got in his IEP, but we're trying to get him an AAC device through the school system because of the limits of the insurance and Medicaid on providing devices, and so we've put in a request for an evaluation, but the person that is in charge of that is off over the whole summer, and so it sounds like they're not going to actually be able to start that until October. Does that sound reasonable, or what are the guidelines, I guess, around the timing of an evaluation for an AAC device? And we obviously want to have a relationship with this person for the next, number of years, so we don't want to push inappropriately, but also want to know kind of what our rights are there.
Okay, so yes, you're right to be asking for the evaluation, and that's great because they will see, is assistive technology needed, and do that assessment. I'm a little bit confused why they picked that it would begin in October.
Like if it's an ongoing process. They kind of said October would be the earliest they would
have the results?
Yes.
Okay.
I believe so.
I
guess I want to know if that sounds right.
Yeah, that makes more sense because they're going to want the transition of getting back into school, so the child will have time to transition and be back in routine and comfortable and normal, or learn the routine in general, and then they'll start setting up times to do the assessment and pull out, and you should be getting surveys as well and ask questions as well too as a part of that assessment.
Great, thank you.
Hi, so I guess I'm kind of just wondering, what is reasonable to expect for a 3-year-old just entering into the school system in terms of therapy services? Because our son, I went to an IEP meeting knowing that we basically already had lined up the financial aid for him to stay in his current program that he's in, which is a private program with therapy. But I was trying to see, what are they going to offer? And I was so horrified by how terrible everything that they were, and I'm in Houston Independent School District. I was so horrified that it made me feel like I could not even, begin to put him in a program there. I mean, they were no speech therapy, no OT, and they were trying to tell me that oral motor function is not educational in nature, so no one would ever work with him on that. I mean, it was just, they were basically just saying he'll go into Powell's classroom, a speech therapist will come in and see the entire class once a week for 30 minutes. That's it.
So basically, it's based on what their classroom program looks like. So it doesn't, my son is completely nonverbal, has terrible receptive.
He doesn't have. I understand they're not going to give him PT. He probably needs PT, but he walks, so okay, whatever. But
access.
But I mean, he has terrible fine motor skills. I mean, it's not like he's high functioning by almost any measure, and that is what the evaluation said. But I mean, they were like, well, yeah, if his speech is really, really bad, maybe we'll pull him out once a week and work with him in a group of and there's going to be a ratio. You know, it would be one thing if he had like a one-on-one person or even two-on-one working with him implementing like recommendations, but it's something like 1 to 6, and I'm like, I mean, I have him have one-on-one right now in childcare.
Right.
So, I mean, I came out, I gave them the example, like, he needs oral motor. Like, we've worked with him forever just to get him to stick out his tongue, and I have the SLP telling me, well, sticking out your tongue is not educational in nature, so, and I was like, obviously that's to learn to speak, not like just for its own sake, but with a straight face looking at me like, oh, we wouldn't work on anything like that. So anyway, I was just wondering, like, maybe I'm totally off base, but, you know, what seemed reasonable to me was not what they thought was reasonable.
Yeah, so again, a lot of times, you know, what your expectations are, their expectations are, sometimes don't align. And when I would, like, going back to this parent earlier, I would want to review their assessments. That's what I would do. I'd go back to her question and say, I'd like to see the assessments that drove those recommendations. I really would, because that doesn't, to me, what you're saying, it doesn't align with that. So.
Did they even do an assessment on your child?
Was it an FIE, full initial eval? Yeah, yeah. That's a summary of it. Was it thorough?
Yes and no. They didn't have an OT there at all. They only had a speech therapist. They didn't evaluate OT stuff.
Yeah.
Really, they just basically said in there he does not need an augmented communication device.
Yeah, see. Yeah, it sounds like it's more based on observation and what they just typically do, you know, what is just typical, what they do. So I would ask to see the results, and then with you know, emphasizing about OT, I would definitely say I want a, you know, formal OT eval. I want a formal OT evaluation, especially since they didn't do it, or that if she wasn't present.
Okay, this is the last question.
Hi, can you, my question is about functional behavior analysis. Can you give me, I don't know, a few examples in what situation or what kind of behaviors should we use this kind of tool?
Okay, these behaviors, it's going to be dependent on really level of functioning. It's a great question, but a variety. It goes back to if that behavior, again, is interfering with their learning or the learning of others, and they're not able to make progress in their program, then that assessment should be done. So for some kids, it could be because, you know, they're engaging in behaviors of repetitive behaviors that they're engaging in, and those repetitive behaviors are interfering with them, you know, getting the instruction that they need or participating with the group that they need to be participating with. We have some students that are highly aggressive, some that are aggressive but with a low intensity, but the reality is, even if I'm swatting, whether I'm swatting or full hitting Wendy, if that is something that is impeding the learning, then it needs to be addressed. So typically there are problematic behaviors, and even a lot of times people just say non-compliance, but non-compliance is very broad. It's what is non-compliance? You know, non-compliance is the act of not behaving, the act of no behavior. So what exactly are they engaging in? Are they staring up at the wall, and that's how they're not completing their work? Or is it that they are engaging in other behaviors and that's why they're not? Or is it because they're talking out so much that that is interfering with their learning? So it really, really just depends on each individual. And the data collection is the key piece, is that the teacher should have data to support that this is occurring this often, whether it's frequency, it could be duration data, it could be intensity data, it could be a percentage of on task versus off task, but those are things that you would really want to look at to see, you know, how much time, you know, are they able to get instruction and what behaviors are impeding that. Mm-hmm.
Thank you very much. And your next session, just announce what your next session is, because it comes right after this, correct?
We're going to be, yes, we'll be doing an introduction to applied behavioral analysis, okay?
So you might be, thank you very much.
Thanks, and we'll be talking about the functional assessment. Thank y'all, we really appreciate it.